And when you do ask a question, if you do decide to ask, please just use a first name. If you decide to share your name. And we have other education nights that we have done, and you can find them on our YouTube channel, NAMI Davidson YouTube channel, and you'll get a picture of one of the speakers usually, and then whatever the content is. But we are able to keep everybody's identity confidential by doing it this way. That's why you won't see this repeated in video format. So thank you, Don. Appreciate that very much. So NAMI, the National Alliance on Mental Illness, is an Each One Teach One peer organization. It's been around for 40 years. It's in every state in the country, including Alaska and Hawaii. And it is the largest peer-to-peer organization that provides support, education, advocacy, and awareness around the subjects of mental health conditions and co-occurring disorders. And we do this in the form of free, almost everything we do is free support groups, peer-to-peer support groups, free caregiver and lived experience education classes. This class, which is representative of our public education classes, and some of our lived experience presentations. So we welcome you, whether you are somebody that is a family member of a loved one with mental health issues, or you're somebody directly impacted by this. We really like to call it stuff, and the reason we call it stuff is because whatever it is, it doesn't always have a name. You just know that whatever your stuff is, it's impacting your life. But the other thing is, by calling it that, we like to disempower whatever that is and empower you. And that's why we do what we do. So you are not a big walking blob of schizophrenia or bipolar disorder or OCD or PTSD. You're you. And we are here to provide support. We are one of the best sources of mental health and co-occurring information and referral in the Middle Tennessee area. So if you need us and you've got something you're trying to deal with, please feel free to reach out to us. We'll do whatever we can. I like to tell people the magic fairy dust is gone. We don't have answers to everything, but we're pretty darn good in what we do. So don't hesitate to reach out. And if Don, if you will go ahead in the chat box and put our NAMI Davidson phone number and our website, that would be terrific. So welcome. We are so delighted to bring this program to you tonight. We have three guests. We have Mark Liverman of the Department of Mental Health ISP, or Individual Support Placement Program. We have Paul Hines, and Paul, I want to make sure is it American Job Services, or is that correct? American Job Services?
Correct. Yes,
Good.
correct. Mm-hmm.
Thank you. And then we have, where's Rosie? I saw Rosie. There she is. We have Rosie Thompson of Goodwill Industries. So we're going to start out with Mark Liverman, and we're going to start out with Mark because Mark is going to be able to tell you what they do around coaching people and supporting people in their various programs to be able to be ready or assist in employment. A lot of our people want to work. The anxiety that can come along with trying to get a job when you're dealing with your stuff can be difficult. A lot of times, if they do get a job, they have a hard time keeping it because they're not supported along the way. And Mark will share some things with you. And then we have Paul and we have Rosie, who also offer not only placement, but information. So without further ado, I'm going to introduce Mark Liverman and let you take over the show here.
Thank you so much, Robin. I appreciate, Don, you sending me the link earlier today. Appreciate being able to talk with you all this evening. Can everybody hear me okay?
Yeah.
Okay, good. I have a few slides to run through, and in doing so, I'll introduce the work that I do for the Tennessee Department of Mental Health and Substance Abuse Services. I see Nicole Garrett is in this meeting as well. She's one of the she works for one of the agencies that we partner with, so I'm glad to see her. Glad to meet you all. So let's jump right in. Let's see. Can everybody see that?
Yeah.
Okay.
Then are you going to do the slideshow, Mark? There we go.
Yes,
That
ma'am.
works.
Everybody good? Still follow me?
Mhm.
Should see a slide that says innovation in mental health services.
Yeah.
Okay, good. So I'll talk about the division that I work for. And Robin, remind me of how much time I have, and I'll keep track of that.
So Mark, we'll go with 20 minutes in presentation for each of you, now that we know we have all three. And then that'll leave us time at the end for people to ask questions.
Okay. So Don, if I'm going a little long, throw something at me, tell me to hurry it up.
That's part of my job. I understand.
All right.
Okay.
I appreciate it. So there are three big buckets for the Department of Mental Health and Substance Abuse Services, or three divisions. There is a division of mental health services, which is the division that I work in. There's a division of substance abuse services, and then there's also the division of hospital services, just to give you a sense of the type of work that I involve myself in every day. Within the division of mental health services, there are four categories, right? There's education, there's prevention, there is recovery, and then there's treatment. I work in the space of recovery. So both of the programs that I oversee focus on helping people enter into and maintain their recovery. I do this work and benefit from this work as well. I use the services that I promote. My daughter, who is 14, has PTSD and major depressive disorder. She may stop in later in a few minutes to say hi, but I use the services as well in caring for her. So very proud of the work that the department does, very happy about the two initiatives that I oversee. So let's talk about my work specifically. There is an office of two from the office that I work from. Myself and Stephanie Cooper, who is the assistant director of the Office of Wellness and Employment. And I'll talk about wellness very quickly because I realize that wellness is not the focus of this meeting. However, I think they work in tandem together. So the wellness initiative that I oversee is called My Health, My Choice, My Life. And so you might ask, well, why focus on that? Because what we know is that people with serious mental illness die about 25 years earlier than the general population. This is data that's giving me this information. And so the reason that they're dying sooner is because of treatable medical conditions. Folks with mental illness tend to use or tend to have access to more fatty foods, or tend to exercise less, tend to use tobacco products more. And so this work within My Health, My Choice, My Life helps people to take better care of themselves, to exercise more, to use tobacco products less, and to use a diet to maintain their physical health. The way that we are able to reach folks across the state with this particular initiative is in the east side of the state, we have peer wellness coaches that will meet with people one-on-one and provide service and guidance to those individuals. Many of you know about the peer support centers. There are 40 of them, 45 of them across the state. And all of those peer support centers use these programs within the My Health, My Choice, My Life initiative to help people take better care of themselves. Some of those programs include diabetes self-management, chronic pain self-management, chronic disease self-management, and as I said earlier, a tobacco-free curriculum, which are all evidence-based that help people self-manage, take better care of themselves. We also offer, which is the focus of my discussion tonight, individual placement and support. And I'll refer to that model going forward as IPS. So we partner with a number of agencies across the state that use this model in helping people find competitive work and maintain their work. What we know about people that have mental illness is that typically they can find their own job. Just in many cases, they need support maintaining that job, right? So when you're at work, you may experience symptoms, and rather than the supervisor understanding how to support a person when they're symptomatic, it could lead to job loss, right? And so IPS works with the employers, works with the people that are working, and also supports the family members in making sure that the person who is receiving the service can stay at work and maintain their job. So why do people want to work? Anybody drop something in the chat. Why do people want to work? And in presentation mode, I can't see the chat. So
that's what I was just thinking.
yeah, so people want to work.
To have a purpose. To have a purpose.
To have a purpose, to make money, right? I mean, it's the obvious reason you want money, right?
Mhm.
And so there are many benefits to work, to improve self-esteem, to increase your social networks, right? To increase your quality of life. You know, you might drive, I used to drive an old truck, and working is helping me get a different type of truck, right? To better control your symptoms, reduce substance use. When you're busy at work, you're not thinking about and focused on substances because you're trying to do your job. And then obviously also to reduce dependency on mental health services. The way we provide IPS in Tennessee is in collaboration with the Department of Vocational Rehabilitation. So we work together with the VR counselors and our IPS providers in offering IPS. VR provides some funding for the agency to provide this service to recipients for free. And they also provide a wealth of experience in supporting people in their life of recovery. So we work in collaboration with VR. When we started promoting this program, and when I say we, I mean the Department of Mental Health and Substance Abuse Services, we started in 2013 with 4 sites and 1 trainer. Now in 2022, we have 14 agencies that have IPS programs and 26 different teams across the state. Those trainers work with the agencies because it's an evidence-based model to support them with new staff that need to be trained and to provide support and guidance and training with making sure the model is provided according to the evidence. Don, has there been any questions that popped up, or should I just keep rolling? Okay, all right.
Yeah, and Mark, I think what we'll do is since when everybody's done, when you're done with your presentation, and you know, the same for Paul and Rosie, when we'll bring down the PowerPoint so we can see everybody, and then we'll be able to let them ask questions, because then we'll be able to bring them to your attention if they're interested in doing
And
that.
again, feel free to write it in the chat, and I can read your question if you don't feel comfortable yourself.
Mm-hmm. Yeah, and be taken, and you can be writing down while Mark is talking if you want to grab a piece of paper and write something down so you don't forget, so that you can ask.
And so some of you may be interested in numbers. Just so you know, we keep data about the IPS program. Last year, during, I want to say during the pandemic, but we're still in it, aren't we? But last fiscal year, we served 1,096 people with this program. Roughly half of them got a job, and half of them began working or worked 90 days or more. And depending on where you're looking at this, or you know what work you do, you may not think that's a lot, but some of these folks have never worked. And so for them to get a job, to maintain that job, in many cases for more than 90 days, is significant. Some of them have never even applied for a job. So the fact that they not only applied and they remained at work, but also were successful there is a remarkable achievement. I've got a couple of videos that I want to show just to give you a sense of how this program works. I'd like for you to hear from the folks that have benefited from IPS. I think that's the best way to tell this story. So I hope this will play within the presentation. Am I still, can you all see the IPS webpage, or?
Yeah, go ahead, Mark. I think it will.
Okay, let's see.
If not, what we can do is have you navigate to, well, you know, to that page, or one of us can navigate to it and we can screen share.
Okay, so I don't hear the volume, so maybe you all can navigate.
Okay. So which one would you like us to go to?
So just go to the department's website. Are you familiar with that?
Yeah.
Okay, and then select mental health services,
Mhm.
IPS.
I'm writing this down. Mhm.
Success stories, and then you can play the first video.
Okay. All right. Let me navigate to that.
Probably should have told you that in advance.
That's okay. That's okay.
And I'll stop sharing so that.
Sometimes we just have to work on the fly. It's all
There
right.
we
And
go.
it's fine. And we have a motto here at NAMI Davidson County that as long as nobody dies and we have chocolate, it's okay.
There you go.
Oh. All right. So let me navigate to TDMH.
Probably should have warned you that everybody's faces are coming back.
There we go. Mental health, substance abuse services, IPS supported employment. And videos. Where are the videos? Okay, so I'm on the IPS supported employment page.
Yeah, if you look
And
at the
these are the
ribbon,
videos over here on the right.
well, if you look at the ribbon at the top, you should see success stories.
Not there yet. Hang on. Success stories. There it is. Got it.
And then you'll see several videos and you can play Cody's story to start off.
Okay, very good. And then I will, let me get back on this so I can share screen. There we go. And we'll share. And
Okie dokie.
is everybody seeing that?
Cody's turned out to be an excellent employee. He's always smiling. He's always got a joke for you. He keeps morale up back here. What are you looking at? These are granny chargers.
I began working with Cody probably about a year ago. When I came job developing, I found this job, and then I called Cody in and me and him discussed it.
Now written down. All the amps, the volts, all 9 yards.
I assisted him with completing the job application, and he got an interview on the spot. So they asked him when would he like to start. This was on a Wednesday. So he said, I would like to start tomorrow.
He's worked his way from just unwrapping the boxes to he's the guy that says whether it goes or doesn't. It ain't bad.
Cody has advanced up. He's actually trained three other employees.
He's got quite a bit of responsibility on him, and he handles it quite well. It is hard to get people in here, especially in this environment that we're in right now. We have 15 open positions right now that we need to fill immediately. So anytime we can find somebody that we can work with, like Cody, we're more than happy to.
Cody is on the road to success. It's just rewarding and gratifying to me. Because when I started working with Cody, Cody didn't have transportation, but now he got a car where he could drive himself, and he's actually moving into his own apartment. Cody has found that he can be self-independent. He can be successful.
Okay. And I'm going to stop share. All right. Is that good,
Thank you.
Mark?
That was good. There are several success stories on our webpage. I would encourage you all to take a look at those. I'm going to share one more time so you all have my contact information should you need to reach out. Let's see.
And those of you that are on here tonight, Mark is going to share his presentation with us. And should you desire it, we would be more than happy to share this with you.
And that was a very quick and dirty overview of IPS. I mean, because it's an evidence-based model, we can go into several facets. There are 8 principles that would have taken the entire 20 minutes to discuss, but I wanted to just kind of whet your appetite for the model. But again, that is my contact information. I'm happy to meet or travel or talk with anyone about the program. So I'm going to stop sharing so I can see everyone's face. And Don, I think your advice was to wait until the end for questions, or was it after each present? Okay, good. All right. Well, again, thank you for the opportunity to present, Robin and Don, and it's good to see you all. I'll be around. So feel free to write your questions down and I'll be here to answer them.
Probably do the extra large.
And so I, definitely when the other presentations are done, I know I have questions for you that so we look forward to doing that with you. All right, well, next up we have Paul Hines. And Paul is with American Job Services. And Paul, the stage is yours.
All right. Can you hear me?
Yes.
Yeah.
Okay. You know what? I wasn't going to do a PowerPoint presentation, but I saw his and I decided to do a PowerPoint presentation. So let me go ahead and share my screen and see if everybody can see it.
All right.
All right. Let me see how we do this here. Okay. Oh. Okay. Video settings and then share screen.
Yeah, you should have at the bottom a share screen.
Okay, I selected share screen. Can you see my screen now?
No, did you hit share?
Share
You have to
screen.
hit share. You have to hit in the lower, I think, right corner, it'll say share. Once you've got the screen that you want.
Share screen. See it. Okay.
There we go.
Can y'all see that?
Yeah.
You can now. Thank you, Paul.
All right. Okay. All right. Let me get it to the slideshow.
All right.
Uh-oh. Something happened.
Enable.
Okay.
There we go.
All right. Y'all got it?
Got it.
All right. Okay. Well, yeah, this is our basic overview of the American Job Center. We kind of give this PowerPoint presentation when we go out and do outreach. We go to schools or we have to give a presentation to employees or whatever. So just want to give you a brief history of the American Job Center and who we are, where we're located, and some of the resources that we have available to the public. As you can see, this is our address. If you live in Davidson County, we only have one AJC in Davidson County. It's in 665 Mainstream Drive. We actually share this building with the Department of Health. If you're familiar with the Metro Center area, then that's where we are. It used to be the actually old gas building in the Metro Center area. It's like 10 minutes away from the Titans facility where they practice. My name is Paul Hines. I'm the site lead. I actually started out as a career specialist on a bus, which I'll tell you about that during the presentation. From there, I went to a program manager for the SNAP ENT program. And then I went to, from there I was promoted, and then I came back to the American Job Center as an assistant. Now I'm the site lead for the American Job Center here in Nashville. All right. So this is how it's designed. We have a total of 83 American Job Centers throughout the whole state. We have 9 labor workforce LWDA areas. In the whole state, we have 22 comprehensive American Job Centers. And what a comprehensive American Job Center, it basically has a lot of federal programs and federal partners. They're the largest centers. We have 55 affiliate centers. Those are smaller centers, so you'll find those in the small rural areas. They're not as large. And we also have 6 access points. Now, those access points are very small. They just may have 2 or 3 computers set up in a resource room. Even though they are a little different, all the AJCs pretty much provide, all the AJCs, whether it's comprehensive affiliate or access points, have the 2 same things. They're going to have a resource room, and they're going to have staff, career center staff, and employers. All right. Okay. All right. What is the American Job Center? All right, we are a part of the Tennessee Department of Labor Workforce Development, Employment Security Division. When people hear American Job Center, they always think of the unemployment center. That's where you come for unemployment. Originally, that's what it was. We were just strictly unemployment, but right now we offer so much more. Now, over the past year, due to COVID, over 250,000 unemployment claims were filed. And so people, when they filed unemployment claims, they had issues, they would come to the American Job Center to get those issues, you know, done, get those issues resolved. We assist with that as well. Basically, the American Job Center was created back in 1933. It was legislation passed by Theodore Roosevelt. It was called the Wagner-Peyser Act. And it was basically turned into the employment centers. It's where job seekers and employers meet. The American Job Center is technically a collaboration of different partners all on the one roof. So it's a one-stop shop. Previously, you would come, if you were coming to see Voc Rehab, you would have to go to another building. If you were coming for unemployment, you would go to another building. So basically, we've taken all the resources and put them under one roof, not to inconvenience the job seekers. So we have all these resources under one roof, and we call it the one-stop shop, the American Job Center. All right, services for job seekers. So you're wondering, okay, what do y'all do? I heard about the American Job Center. I just thought you guys do unemployment, but we do a lot more than that. Basically, all our AJCs, comprehensive affiliates, they all, like I said, they all have a resource center. So we have computer and internet access. Everyone doesn't have that. As you all may know, internet is very expensive, and depending on where you live, you may live in a rural area, you may not have access to internet or computers. The paper applications, filing for unemployment, paper applications, when you're filing, applying for a job, that is no longer, paper applications are gone. So everyone has to get on a computer and use a computer. All of these services are free to the job seeker. We have all our AJCs have job fairs, some larger than others. Here in Nashville, we have job fairs every month. Actually, we're starting to have them twice a week. So employers come and they set up in our lobby. Our business service team contact employers and try to find out, what their needs are. And so we set them up in our center as well. So you have access to employers. We have career coaches. So if you're not really familiar with what we do, or you wanted to change, industries, you're just out of high school, or you want to make a change, you don't know what you want to do, we can do some assessments and sit down with you one-on-one and to develop career plans. We have short-term training as well, and I'll go into that a little later. We also, a big service that we provide are the workshops. We gear the workshops toward the clientele. So, we get a lot of people to come in and may ask questions about, resumes. So, we could, how to make a marketable resume. Now things have changed. Virtual interviewing, before the pandemic, everyone used to go to employers and sit down face to face. Now, virtual interviewing is a big thing. So you need to know how to virtual interview. So we have workshops on that. Intro to Gmail. You'd be amazed how many people don't have a Gmail account or really know how to work a computer, know how to set up an email account. So we have an intro to Gmail, Yahoo, etc. So we kind of base our workshops off the needs of the customers. And lastly, of course, we have access to employers with all industries: hospitality, production, manufacturing. Anytime you come to the Career Center, we have, hot jobs. We have employers sitting in the lobby. If you just come in and say, look, I need a job, don't know what I want to do, or I can work this amount of hours, we can find you employment. Short-term training. If you qualify for short-term training, we have in-demand industries with bright outlooks. We only pay for training that's in demand. So we're not going to set you up to fail. If it's not a high outlook or a lot of jobs in that industry, we will not send you to training. We pay up to $5,000 in funding. If you qualify, the eligible requirements for training: low income, underemployed, you're receiving public assistance, dislocated worker, unemployed, received unemployment in the last 5 years, or you're laid off of your job, no fault to your own, if it goes overseas or something. Those will be eligible requirements that you will be eligible for training. All right, training for in-demand job sectors. Like I said, primarily our training consists of, healthcare, transportation and logistics, medical assistance, dental assistance, pharmacy tech, surgery tech, IT, network security, construction, the logistics. I say the biggest training, we send people to training CDL drivers. CDL drivers right now are starting out. They can make up to $60,000 over the road or even more. So that's our biggest industry that we send people into training. People want to do CDL and get their CDL license, which that can take about 5 weeks. We have employers already set up. So once you complete that training, they can go ahead and put you on the road. We see a lot of people coming in requesting CDL training. Construction, construction design, welding, HVAC technicians. So if you want to work on air conditioning, that's big. They're starting off pretty good to salaries. It's a lot of work in HVAC, megatronics. It's a lot. It's a lot. So these are the 4 main industries we provide training for. All right, some of our federal programs that we have career specialists, and you can be referred to some of these programs. SNAP ENT education and training. So if you are already receiving food stamps, you may qualify for our employment and training department. And that's, of course, the 4 main industries. We can send you to training for that. If you're a veteran and you have some barriers, we have case managers available for you to help you eliminate those barriers. RESEA is called a Reemployment Services and Eligibility Assessment Program. So say if you've been laid off your job and you're on unemployment, but it's going to be hard for you to find a comparable job, or if you're in a certain industry, it's a hard to find industry. We pair you up with a career specialist and we try to help you and develop an employment plan. And we try to find a job for you. So, if you don't have a resume, if you're lacking certain skills, we try to get your skill sets up so to find you employment. So you can find something before your unemployment runs out. Unemployment typically runs about 6 months. And believe it or not, it could take you that long to find that next job or making what you were making. So that's where we kind of come in with the career advisors, and we kind of sit with you and kind of help you develop a plan and look for, something suitable. TAATRA, assisting trade adjustment assistance. So if you lose your job, no fault to your own, if your job is outsourced and it goes overseas and you're laid off, we can provide training for you with that program, similar to the other programs, career development program. You could even get a weekly allowance similar to unemployment. Reentry is recently incarcerated. So anybody who's been recently incarcerated will have a hard time finding a job on their own. They have a lot of barriers. So when we come in, we case manage those individuals. We go out and find employment for those individuals, felon-friendly employers who are looking to take a chance on those individuals, provide training for them, on-the-job training, apprenticeship programs. So we try to help them overcome those barriers and connect the dots and get them reacclimated into society. All right. Core teams within our American Job Center. All our American Job Centers have 3 core teams. We have a business service team, so they work with the employers. They're responsible for engaging the employers, finding out what their needs are, bringing them to the center. We have a welcome function team. So when you go to a career center, the frontline staff, I call them the frontline staff. They're the ones who are working in the resource room. They're the ones who are checking you in and doing assessments. And we have a career development team, and they're the ones who actually enroll you into training and give you the test and determine eligibility before you can be enrolled into training. Everyone can still hear me?
Yes, thank you.
Okay. All right. We have contractors. We work with a lot of different state agencies. EDSI is one of our contractors that we use, and they pretty much provide the training. They enroll clients into training. Workforce Essentials, we have TANF, which is Temporary Assistance for Needy Families. So if you have, it's similar to SNAP, but if you have kids, they provide assistance to you for, with kids. They pay for daycare. If you're 16 to 24, Metro Action Commission is MAC. They are our contractor for that. They provide you with training, tutoring, and all services associated with that, Title I. Voc Rehab, Tennessee Department of Human Services. And of course, we have adult education. We have 2 different agencies that provide adult education. We have classes at the American Job Center now, 4 days a week. We have Workforce Essentials who does classes 2 days a week, and Metro Action Commission does them 4 days a week. And we also provide the HiSET testing, I think 3 times a month at our location in Nashville. Now, this is for you all that are on the call. If you hadn't heard of jobsfortn.gov, I want you to get really familiar with this. Everything is pretty much it's online now. This is our system, Jobs for TN. So if you're looking for a job, if you're applying for unemployment benefits, you will need to create a profile in this Jobs for TN system. It does so much. It's easy. You can create a virtual recruiter. Once you can put a resume in here, the virtual recruiter will look for jobs for you. You can refer yourself. We can refer you to job vacancies. You can find out labor market information. So if you're living in Nashville and you want to move out to East Tennessee, Knoxville, and you're not familiar with, the industries out there to see what jobs are paying what, we have all that data in this Jobs for TN website. This is what the main page looks like when you log in. As you can see at the bottom here, job seeker solutions, business solutions, labor market information. You want to know what jobs pay, different resources. You can do a keyword search. It's pretty simple. If you're not registered, you just create a username, password. You can come into our centers at any time. We're open Monday through Friday, 8 to 4:30, and we have specialists there that can help and walk you through this system. It spiders in with like Career Builder, LinkedIn, and all those different sites. I know a lot of people use those different sites, but I will suggest this site is primarily, we have so many jobs in here, and it's a benefit to use this site. So that's pretty much what we use when we do assessments. When we're doing career development plans for you, we're going through this site to do that. All right, some of you may think, well, what happens when I come to my first visit at the American Job Center? A lot of people just walk in and don't know. I just rammed off about all these resources we have. It could be overwhelming at times, but basically when you first come in, you check in at the kiosk. We have a kiosk at the front desk, and it'll let you select the appropriate service. So if you're just looking for a job, you need help with a resume, or if you're interested in training, we have all those options. You can select it in the kiosk. You can talk to the front desk specialist, and they'll get you with a career specialist who will sit down with you one-on-one and assess and refer you to the appropriate service. If you're looking just to go in a resource room, you want to check your email, you want to pay a bill, we have a resource room here in Nashville. I think we have 13 different computers set up. You can attend a job fair. If you're just showing up, you say, I need a job. We may have a job fair on site that day. You can attend a job fair. We have scheduled times for workshops depending on your need. If you need a resume, if you need to learn how to look for a job or interview virtually, we have those workshops, and we provide those workshops weekly. We kind of switch it up. We may have certain workshops this month, and next month we may have another type of workshops. Okay. You can stay connected with us once you get registered with us in Jobs for TN. Once you register on that Jobs for TN site, we will send you updates when we have job openings. We are constantly contacted by employers just looking for people, and they're sending us flyers, and they're needing people like yesterday. So it's always good to get on our email distribution list, because we can send you things. We're on Facebook. We post anytime we're having a big job fair or open vacancies with a company. We post it on Facebook, Twitter account. This is our main phone number, so you may want to write this down. If you have any questions about your unemployment or about certain companies, Amazon, Nissan, whatever, you can give us a call and kind of ask what's going on and what we're doing for the week. It changes from day to day, but if you're in the job market, I think the American Job Center is your best friend. We connect you with all the employers, and we've we've got thousands of employers that we can connect you with.
So,
go ahead. I'm sorry.
I was going to say, so I'm giving you a 1 minute warning.
Oh, okay. I'm sorry. All right, I'm almost done anyway. This is the mobile American Job Center. So primarily we use this for employers, and we go out to community-based organizations. We go to neighborhoods. This is the American Job Center on wheels. I think it's like 8 different stations inside here with computer slots. We'll come to a neighborhood, stop we have a job fair. We have employers out here. You can come on and get a resume. We can go into jails. We go into schools. We do PowerPoint presentations, workshops. We do it all. We even do adult education classes and testing on this mobile career, mobile bus. So you may see this bus riding around Nashville. And like I said, if you ever wanted the bus to come set up at your site or neighborhood or community center, we have online, you can request it. All right, this is just some of the partners that we partner with. I'm not gonna go over all of them, but you can see.
Thank you.
And that will conclude my presentation. I mean, if y'all have any questions,
Thank
just
you,
feel
Paul.
free to ask. Sorry, I
so-
took up I
That's
took up so
okay.
much
You're fine.
time.
You're fine.
You got a lot of great information, and so if you want to stop sharing, and then we'll
Okay.
get to see everybody, and we're gonna move on to Rosie here in just a minute. And Paul, I have to say, we work with MAC, Metro Action Commission,
Mhm.
and until I saw you flash that address up there, I've been out there. I was speaking there in December. They asked
really?
us to come out. And
Really?
so, yeah, so it was speaking
Okay.
to your youth services group.
Oh, okay. Okay.
Yeah, yeah.
Well,
So didn't realize that was you. So that's terrific. All right. So the next thing we're going to do, so thank you for sharing. There's a lot of great information, and I'll ask you if you're also willing to share your PowerPoint so that we can
Yes.
have it available for people. That would be
Will do.
terrific. And then Rosie, what would you like to share with us about Goodwill Industries?
You're still muted, Rosie. There you go.
She's getting there. She was getting there.
All right. Good evening, everyone. How's everybody doing?
Pretty good.
Awesome. So I'm just going to share a little bit. I wasn't going to do a PowerPoint presentation either. There's so much that has changed since I made this PowerPoint presentation at Goodwill. So I'm Rosie Thompson. I'm one of the career coaches at the Nashville Herman Street office at 937 Herman Street. Tiffany Fortson is also my other coworker. And so we do various things. And I'm just going to share my screen. Let me go to which one I want to share. This one. So I have two things open here, which is a PowerPoint presentation. And of course, this is our logo, which is Goodwill. Our mission is changing lives through education, training, and employment. So that's something that we strive to do at Goodwill. The other thing is that, just to give you a little history about Goodwill, Goodwill started in 1902 by Edgar Helms, and he decided that he took broken goods and wanted to give people a job. There were people without employment. So he wanted to make a way for them to make money, but also be able to provide goods for individuals who couldn't afford new goods. So he developed this idea and got people to start working at Goodwill. So Goodwill started in Nashville in 1957. And so, Edgar Ham's idea was not a hand out, but a hand up. So it's like he wanted to give people an opportunity to do things. Also, at Goodwill, we have different training programs. I'm going to minimize this, and I'm going to just show you our website, which is giveit2goodwill.org. And as you can see, there's so many different opportunities. And let me just show you, we have 9 different career centers in the Middle Tennessee area. So we have, and let me just bring that up for you so that you can see, we have one in Brentwood, Clarksville, Cookeville, Hendersonville, Jackson, Mount Juliet, Murfreesboro, Nashville, Spring Hill, and then we have definitely our location. Did I skip Hendersonville, Jackson? I think those are all 9. But as you can see, and we have 2 career coaches at each of our centers. Goodwill has 28 retail stores. We have 2 outlet stores, And then we have 18 donation sites. So we have individuals at all of our centers to be able to assist you in whatever area that you need. And I just wanted to show you just some of the different training. We too are also working with Metro Action Commission. They come to our center and they do the HiSET testing. And then once they're finished, then they'll work it out with individuals and they'll go to American Job Center, take classes and that sort of thing. Other things that we have, I'm just going to show you, and I sent over a lot of our training, which has changed a great deal. And I'm just going to show you, if anyone is interested in any of our training, we have call center training, we have custodial, construction, we have forklift, we have Google IT, we have social media, and then we also have the National Retail Federation customer service. Those two, the retail training is only offered at our Hendersonville location and also Clarksville location. There's so much that is going on in Goodwill, and we have career coaches, like I said, that will assist. We also offer job fairs weekly at all of our centers, and they're also posted on our webpage. We also just help individuals with employability skills. So we have virtual trainings that are available for individuals, resume, how to be successful at work. We have a work from home training, just various different programs that we offer. And so if anyone is interested in any of the trainings, of course, they can go to our website, give it the number to goodwill.org, and they can go in and send in a, like if somebody's interested, there's a form that they can just fill out, a minimum form, and they can put their information, their name, email address, and phone number. And then it will come to either center, whichever is closest, and they ask which area is closest to you. So I did send Don over a lot of the training programs that we have. Our construction class, our new one is going to start February 14th. And right now, call center is on hold because of illness of the instructor. So as soon as she's better, then she'll come back and let us know when she's ready to start. But forklift normally costs $100. But if they come in and we do a service plan, it's free. They don't have to pay for that. With the construction training, all of that is free. Custodial, call center. Those are our three trainings that offer a stipend. So call center will give you $80 a week while you're in the training. It's a 4-week training. Custodial training will give $150 a week while you're in the training. And also construction will give $100 a week. You will get the certification, the NCCER certification, and also forklift certification as well. And that's good for 3 years. So we've got a lot going on at Goodwill. I just encourage you to go on. You can always find out whenever we're having a job fair. That information is also on our website. And like I said, training, education, and employment, that's what we're all about, in helping individuals to be successful. We recommend the ABCs. We want you to find a job, then a better job, and then focus on a career.
All right, Rosie, thank you so much. And we'll go ahead and put that down.
And Robin, I'd like to reference out, Rosie referenced some materials that she sent me. Everyone who registered should have gotten attachments with their emails as a reminder before tonight that have those from both Rosie and Paul. So if you did not receive those, just email me at outreach@namidavidson.org and ask for them again, but they should have been attached to the email, the reminder email that I sent out in the last day or two, depending on when you registered.
That's great. And Don, would you put your email address in the chat?
Sure. And I will also say that on our website, we have under our groups and resources, a Middle Tennessee mental health resources. If you scroll down a little bit, we do have all three of our presenters tonight's information under supported employment. So you can find it there too.
That's excellent. All right. All right, and then we'll stop sharing here, and then I will say something and share with you guys. I know about Career Solutions at Goodwill firsthand, because when I moved to Nashville 12 years ago and was looking for a job, somebody said, you should check with Goodwill. And I said, well, how would I check with Goodwill? Well, they have job services centers. So the NAMI Tennessee was actually promoting a job through Goodwill Career Solutions. And that's how I got started with NAMI in Tennessee. I've since moved over, from NAMI Tennessee to NAMI Davidson, but I made use of those services. So guys, this was a lot of information. I want to bring up a few things and then I want you to ask your questions, but I heard some things that kind of triggered me when I was thinking of some of our folks. And I heard words like, we will give you a test. And I wondered how many people out there sitting, listening were going, oh, and just kind of backed up a little when we heard, we will give you a test. Because there are people with test anxiety. This is why sometimes people with mental health issues have a hard time getting a job. So that might be a little scary for you. And then I heard create a profile and a resume virtually. And again, it's like that sounds like a lot. And then, but I also heard words like one-on-one, will help you, will be there. So I'm going to go to, I'm going to ask the question to you. Then I want any one of you that are curious or, have questions to ask. Mark, I'm going to start with you because this is where I primarily think of this program. What would you say to the person when they said, oh, listen, as part of this, we're going to give you a test, which for, that can really spark anxiety in people. What would you say and how would you help people manage that concern?
Well, one of the things that, first of all, thank you for the question. One of the things that we know, and the research tells us about IPS, individual placement and support, is that people work best when supported. And that's true for me, that's true for Robin, that's true for everybody on this call. And so the whole goal of IPS is to work beside the person that is seeking employment. That could include helping the individual create a resume, helping them, even going to the interview with them if they feel like that they need that type of support, and then obviously acting on behalf of them or with them with employers. So IPS is truly a supported employment model from the beginning to, if there is a test involved, helping that person prepare for that test, or finding a way to assess their skills without a test, right? The goal is to get the person into the job that they're looking for and then to support them as they're working. Does that answer your question, Robin?
Yeah, that's terrific. And Paul, what would you say to the same question? Because it sounded like you had supports there too. What can you share?
Well, I'm gonna have to pretty much what Mr. Liverman said. We do the same thing. Now, our test is a basic reading, math, and skills test, and it's kind of depending on what industry they're wanting to go in, and then we it's a one-on-one assessment. We kind of sit down with them and kind of talk to them about their expectations and what it takes to enroll in this training, how long the training is. So we do like a a one-on-one assessment. And, if it's something, that we feel that they need a little work on, it could be, a resume, it could be interviewing, with test taking, they can take it more, more times than one. But yeah, it's like we hold their hands. So it's not like, hey, just come in, take this test, pass or fail. If you fail it, then you're out the door. You don't qualify for any of our services. It's not like that at all.
Okay, that's reassuring. What about you, Rosie? Same thing.
So yes, so when individuals come in, we usually do what's called ONET. And so we have the individuals to go in and just find out what they would like to do just by the assessment that we offer them. And then once we finish with the ONET, we go over the information and just kind of tell them what they qualified for, what their interest was, and then whether they're conventional or whether they're I can't think of all of the different categories, but we go in there and we help them to try to just find out what it is that they're good at, what skills that they already have, what are they looking for, whether it's full-time, part-time, and then we help them. We have mock interviews. So if someone isn't comfortable with interviewing, then we go over and kind of do a mock interview, always checking resumes to make sure that they are good. And we tell them that when when you come in for an interview, an employer, doesn't have a lot of time. So you don't want a lengthy resume, 1 page, 1 to 2 pages at the most. That's it, because they're just gonna glance over it. So you just want to have your points in there and just your main points, and they're looking at your history and things like that. So we just tell them, we'll help them in any way that they can, just whatever it is that they want to do. We'll walk with them, help them complete applications and help them through the interviews. A lot of times individuals come to use our facility because they're having virtual interviews. So they can come there, use the computers and meet that employer. And we try to put them in a private area so they won't be distracted.
All right, thank you, Rosie. We have Seema here who says, who do I contact in Goodwill or American Jobs? I have a family member with moderate mental health issues. And so can we give the information you guys gave us tonight? Is that okay to do that? And if
Yes.
somebody, and if Seema really wanted that family member to have a point person or somebody they could feel comfortable with, it sounds like they might go to Mark first and Mark would, work along with them, or you guys would have somebody that they would just walk into and that person would help them?
Yes.
Okay. Seema, is that helpful? And again, Don said at the beginning of our presentation, we always say to folks, if there are questions or conversations you want to have that you're not comfortable having in front of a group, we are always available to have an independent conversation with you, to provide support to you. And so Don's got I think he's put his email in the chat if you would like further clarification on that. What other questions might some of you have? This is a really great opportunity to ask anything you want on these folks that are, here involved so deeply in employment.
I have a question
Go
for
ahead, Mark.
Ms. Thompson, if that's okay.
Sure.
Ms. Thompson, I'm from Jackson, Tennessee, and my son has a mental illness. And I'm wondering if Goodwill in Jackson has the capacity to have the ONET initial counseling and that you described so well. Would they be able to help him in Jackson, Tennessee to do that?
Yes, definitely. We have 2 career coaches, Jamie. We have Jamie and Christine. Okay. And so they will definitely help you. They know how to do the assessments. They'll come in and they're really, really, really good people. Jamie has such a love for what she does. And she also has worked with individuals in the mental health field. Christine is another one. She is a sweetheart. So just if you contact them, and like I said, you can go to Give It, the number 2, goodwill.org. You'll see all of the different career center locations, their phone number, addresses. And then on our website as well, you can also see pictures of all of the career coaches. So I encourage you to contact them for sure, and they will be able to address and be able to assist.
Thank you, Rosie, and thank you, Mark, for the question. Do you need any more information, Mark?
Well, I might follow that question up with a question to Mr. Liverman.
Okay.
My son has in the past been connected with Voc Rehab and has really only had sort of counseling. Never has really, I think, felt comfortable with or inclined to have a representative talk to his employer. so that the employer would understand that he had a difficulty. My son has had 45 jobs for which I have had a W-2 form. I know this because we're working toward disability with him, but he wants to work.
Mhm.
But he has no problem getting jobs, but he can't keep the jobs. And he's disinclined to have Voc Rehab represent him with the employer. I don't guess there's really a question in that so much as just a kind of concern on my part. And I wonder what Mr. Liverman might advise here in Jackson, Tennessee. We have worked with Voc Rehab, but what he might advise as far as helping my son overcome that problem of having a representative negotiate with or represent him with the employer.
Well, I hear your question, even though you didn't ask it. And I'm going to tell you what I feel personally and what the IPS model would say in response to the concern you just said. Your son has had 45 work experiences.
Yes, sir.
So what we have learned from your son working 45 jobs is what he likes and what he might dislike. And the way we would approach that with an IPS program is to find out what those dislikes are, but more importantly, find out what he likes, and then try to transition him, support him in getting a job that he likes, and then support him while he's working. I'm going to put in the chat the agency that you should call in Jackson, Tennessee.
Okay.
We have a partner in Jackson, Tennessee. Pathways is the agency. Have you heard of Pathways?
Yes, sir, I have.
Okay. And I'm even going to give you the person's name. I was just on a phone call with her today. And Miss Marie Maxey is the person's name. But again, I'm going to put her contact information in the chat. And they have an IPS program. Miss Marie is the supervisor of that program. And they work with VR. They are not VR. This is not against VR at all. But what VR does with IPS is they find the Marie Maxey's or the agencies in the state to partner with. And those one-on-one services are provided by the agency in collaboration with VR. Does that make sense?
Yes, sir, it certainly does.
Okay, so I'm gonna put Miss Marie's contact information in there. And I feel pretty strongly that Marie and her team can help your son find a job that he's looking for. Those 45 experiences are just that.
Yes, sir.
We learn from that and we build on.
Thank you very much.
Thank you both. Thank you both, Marks. And so we had a question in the chat, and I think it's a very good one. And this is from Patty, and it says, what about childcare during the job assessment process and interviews? Is any of that available? Because that is, we know here in Nashville how tough it is. I'm assuming it's very tough wherever you are in the state of Tennessee. Can any of you speak to support for childcare while somebody is in this process? And I know we have TANF funds.
Yes, we do. And this is Paul again. We do have TANF and we have SNAP ENT, and they do provide childcare. Now, childcare, TANF is handled through workforce essentials. I'm sorry, that's a different agency, Workforce Essentials. I'm not sure the eligibility requirements for that, but if who's ever interested, like I said, they can come to the American Job Center. We'll do a referral to those individuals in that agency, and then they would determine, it depends. I mean, it's a lot of different factors when it comes to childcare. I think the childcare facility has to be on some type of eligible provider list. It won't go to just any childcare. They have to be on a certain state accredited list. But those, if they do qualify for, SNAP benefits or TANF, if they have a child under a certain age, they will qualify for childcare. But I just don't know how much that would be on a weekly basis. I know most daycares could be around like $275, $300 something a week, which is a lot. And I understand that's a hardship, and in a lot of, it's cheaper sometimes for the mother to stay or the father to stay home. And, instead of going to work, they can't really afford the childcare. But those are the two programs, the SNAP ENT and the TANF are the ones who pay for childcare.
Okay.
I've heard down the line that the RECIA program, if you have, more dependents in your family, the RECIA program possibly will start paying for childcare. But I don't know, what the cap would be on that, but that's something I can find out. You have the AJC's number. You can always give us a call and we can get an individual from that agency to provide you with some of the eligibility requirements surrounding childcare.
Okay, so with the American Services Center number, they can call and
Yes.
ask about that.
Yes,
Okay.
and yeah, we would just make a
Okay.
referral to that agency.
Okay, that. Hopefully, Patty, that is helpful for you.
Well, a little corollary to that question, it sounds like there's some assistance, but is it actually covered for people who are starting at zero or in the hole?
Mm-hmm.
Yeah, and before somebody makes their way all the way to the job center, I think just by phone call would be
Yes.
nice.
Yeah,
to
yeah,
be
this
able to
is
get
all really
that.
helpful.
And to make, yes, and we actually have another thing I forgot to mention. All our services are available virtually. So say if you are not, near a job center, we have American Job Center. We have a online site that you can go to, and you can actually schedule an appointment with someone of the agency. Just if you're interested in childcare, you're interested in a job or training, you can schedule an appointment and have one of our career specialists contact you, and we can pretty much do everything over the phone.
That would be great, because if you don't have childcare and you don't want to bring a child with you
Yeah.
to that's
Yeah.
that is so helpful. That's
Yeah.
terrific. Thank you for sharing that. Kimberly had said, what jobs would you recommend for someone with low vision, 2200? Is there anyone specifically contact for support with dual mental health issues and vision disability? And if none of you have that, I'm going to tell you the services for the blind.
Mm-hmm.
So resource, when you've got physical disabilities, one of the resources we're going to recommend to you at NAMI Davidson is the Tennessee Disability Coalition. And they're awful good over there with a number of things that are related to physical disability and employment. I'm sure they can direct you that way.
Mm-hmm.
And then there are the Tennessee Division of Services for the Blind, and that would also be included. And we don't like just giving you names of things. So if any of you want to call us after, like tomorrow, give us a call or send an email to Don. We'll help you find things out. We don't just go do this or do that. We actually will, walk with you too, because we know this stuff is hard, at times to do. And there's just so much out there, and we know how anxiety producing it can be. So just keep that in mind.
What area of the state is the person in? Kimberly, what area of the state are you in, Kimberly?
I'm in Nashville.
Okay, so I work pretty closely with VR, and they have a sensory division. I don't know if you have gotten support from VR at all, but I am in pretty frequent communication with that director, so I can find out who the people are in Nashville and send that to Miss Robin, and she can get that information.
That would be wonderful. Thank you. Something else that came to mind. Does anybody else have any other questions? Because there are some things that I know I saw. And
you hear me now?
Yeah, Margaret, did you have a question, Margaret?
Yeah, I do have a question. I'm trying to figure that right out. Let's see. Certain questions might be for one person. The answer to the other question might be a different person. Quick question. I know this is kind of a general question, but it's an important question, as you're well aware. How to tackle the issue of computer literacy regarding applying for a job and keeping a job. For example, when I worked at Marriott, I've been off work I haven't been working for 2 years. I worked at Marriott for 25 years, and Goodwill is the one that trained me and placed me. And it was a good program for me. It really helped me cushion the blow, learning new information. when I was applying for the job, they showed me where I was going to work, and it was this humongous room full of anything you'd ever imagine. But the Goodwill was able to help me with drive me there. It was a paper application at the time. It was a very hard job, but it lasted 25 years, and I was specially trained through Goodwill, and that got me in the door, and Goodwill also helped me keep the job, so that's good news. I know on the Today Show, they said there are 10 million, about 2 months ago, there are 10 million available jobs, the greatest number in recorded history. But the computer thing is my biggest worry. Should I try to I'm gradually trying to learn a computer. The problem is this, as you're well aware, is there are so many different types of computer languages. And it's not a good idea to be trying to trade something you're not going to use. I mean, if you work somewhere, I guess the best thing would be on the job training. I don't know, but that's a pretty good question. The issue of computer literacy, that's the main thing that's worrying me. One more sidestep thing before I forget. Paul Hines, is that the one, you worked at the food stamps office as well?
I did in the past, yes, ma'am.
Yeah. I'm just wondering, it might be time. My aunt called me yesterday and wondered if I should try to go on food stamps again since I haven't worked for 2 years.
Okay.
It sounds like a good thing. I guess I could just call. I could probably find that number out. Do you happen to know do you happen to know what the number is?
I can find it for you. And that,
Okay.
you would apply through, that's the Department of Human Resources.
Yeah, exactly. And they moved, didn't they? Are they right nearby their older location?
Yeah, they had a location near Metro Center, but they got destroyed. So I think they are on Dedrick Street, I believe.
They're virtual now, Paul.
Oh, they're virtual now. Okay.
Yeah, you can contact DHS, and I'll put their number in the chat as well.
Okay.
But a lot of
Hey,
them.
Margaret, I'm going to interrupt you. What I'm hearing from you is computer training, computer literacy.
Training, yeah, I need computer training.
And can Rosie, Mark, or Paul address that through your services, helping people who are not computer literate?
Yes, so we have a basic computer class, and that class meets twice a month, usually on Thursdays from 9 until 12. And then once, if they're not comfortable, they can always come back. We have people who will come and take the basic computer class over again and said, I need more training. So they'll come and take the class over. We also have what's called OPS, which is Office Productivity. So if anyone needs training in like Word, Excel, Google Docs, Google Sheets, emailing, that sort of thing, we have a 3-day training program. And that next class is going to be, I do believe, the 14th, 15th, and 17th. But it is on our website as well.
February?
Of February. But the next,
14th, 15th,
basic,
and 17th?
Yeah, that's for the OPS. And like the basic training, our next one is going to be the 27th. From 9 until 12. And if you're interested, I put my information in the chat. Call me and then we can get you into that class. I have to check the roster and make sure, but I think you would be good in that class.
And I'm gonna jump in, Rosie.
My name is Rosie Thompson.
Yes, but Margaret, what I can do is I was going to call you tomorrow for our group. I'll give you that information since you're on the phone and can't see the chat. I'm making myself a note to tell you to give you Rosie's information tomorrout, okay?
And just so our speakers and
one more
others
quick
know-
thing. Can I ask another quick question?
hang on.
Margaret, we have several other people who've got some questions, and we need to be mindful of everyone's time. If you want to keep those questions and talk to me about them tomorrow, I can always forward them to Rosie, Paul, and get answers for you.
That works, Margaret. And the other thing I wanted to say was Margaret and other people in our organization are not people who use computers, and our services are always available to everyone. You can do our support groups and different things that we do by a phone, and it doesn't have to be a smartphone. It can just be a simple little flip phone. But we make sure that we have accessibility here for everyone. So if you know anyone that needs our support or even needs the support of these folks, just as Don is going to assist Margaret with any further questions she might have, we would do the same for anyone, because we recognize that not everyone has one of those phones, and not everyone is comfortable. And I'm thinking of a certain person that I know is on here, and I will say that, Rosie, will you confirm that Goodwill Industries, these computer trainings or assistance, if you're not someone who is particularly comfortable with a computer, they have these all over the country, don't they?
They do, yes.
Yeah. So just go to the closest Goodwill, and you can find that information.
Right. Now,
Okay.
I have the contact for Middle Tennessee, but I've called, when someone asked about Knoxville, Tennessee, a couple of weeks ago, I reached out to the Knoxville location. Her son was looking for a job, and so I reached out to them, but she told me that they weren't having job fairs right now, and referred me to the AJC in Knoxville. So
I think you
yeah.
guys that are on this Zoom session can see that there is a lot of collaboration between the three organizations that are here tonight, and some others. So just if you get one, you kind of get all. So I'm sure they will very quickly exchange for you and others. There are other programs around. The Ticket to Work program by Social Security is another program to look into, and that is for people who may be on Social Security disability benefits, and they'd like to work. They'd like to have some purpose, meaning, and activity in their life, and but they may not be quite ready to do that, and they're afraid of losing their benefits while they're trying to make that transition. And so, this is something we weren't able to get you all the speakers we were hoping to, but this is something else, because there are other things out there, guys. And
Robin, I'm going to interrupt real quick. I
Sure,
do know
sure.
there was one person who had their hand up earlier. See if they.
Oh, I didn't see them. Thank you, Don.
Kathy, do you still have a question, or? Yes.
I do have a question, but maybe I could just email, I think, Mr. Liverman tomorrow. He might be the one that would answer my question. My daughter's been with the VR for a year and with no result, and they've moved on to somebody else. And it's kind of the opposite issue of Mark here, where she's had some interviews, but she can't land a job. And she's, college educated but just can't get through the communication process of the interview. And is not receiving, I've been frustrated because we're not getting the help we need.
She in Davidson County? Are you in
She
Davidson
is.
County? Yeah.
Yes,
Just do you have my number?
I do. I copy that down, and if I could call you tomorrow, that would be great.
Yeah, give me a call, and I'd rather get you a person that can help, as we said earlier, rather than just giving you a number or an agency.
Yeah, thank you, Mark, and thank you all of those for those direct contacts are what makes a difference to our folks. Knowing that there's a one-on-one connection, that really does help. Another thing I'm going to suggest to you guys as we get close to our ending time is at NAMI Davidson County, one of the things that we offer is, we know sometimes it's hard to step a foot out of bedroom, out of a living room, and out the door. We know that can be a big deal, and we get that. So maybe you're not ready to go out that door and into a job center or into a job, and that's a big leap for you. So what we want to let you know is we will take a few people at a time in our office to volunteer, people with mental health issues or co-occurring office, and so we don't mind being a bridge, to help you build that confidence up a little bit. And the other thing is to let you know that 3 Thursday nights a month, the 1st, the 2nd, and the 4th, we have a free online social peer engagement group. So that, if you really haven't been connecting with people, especially during the pandemic, but if you want to be around people that understand you and get you, drop into the social peer group. You sign up on our website, on our calendar, or you can reach out to Don, call our phone number if you're not comfortable with computers, and we'll get you set up so that you can at least start socially engaging with people. Maybe that's your first step. Maybe you're not anywhere near ready for the job, but you want to be. So if you want to take a first step and reach out and be part of that social peer group for a while and then make the next step, it's all about taking steps.
And I will say, along with Robin, our Friends Supporting Friends group, what she's referring to, the first time is always difficult for anyone. If you don't feel like, if you want to say pass, just, you know, introduce yourself, that's fine. We understand. A lot of us have gotten to know each other over the last year, but we're a very welcoming group, very lighthearted group, because as we always say, this stuff is hard. Why not have a little bit of smile and laughter for an hour? We all understand. And again, both Robin and I have experience personally and with family members. So we've lived this stuff. So, and for those of you who are here for your family member who has lived experience, encourage them to drop by. I joke with some of our members, it's like a library, it's free. You know, what's it hurt to check out that book once? You know, you don't have to pay for it. You can check out our group. If you don't like it, we understand. You can give us some feedback, but if you do, it can be a bright spot during that week to be around people who understand.
Yeah. And it doesn't matter where in Tennessee you are, it's online. So, and if they don't have, like I said, if they don't have a computer, they can reach out to Don. We've got what, about 5 people, Don, that you contact weekly?
Yes.
Yeah, to remind that are strictly on the phone, but they still get to participate. You know, so we just want to throw that out there for you, because we know sometimes it you know, it helps to have that little bridge and not to make the big leap. And then I will tell you this, that people that we have had previously volunteering for us, I have actually written them job references based on the work that they've done in our office. And so, you know, if they come in regularly and, you know, and I know that, especially if we know that they're looking for a job, if they treat this, you know, like a job, if not, you know, and they want to just come in and kind of get their feet wet, that's good too. That's fine. And we appreciate it. But if I will also, and I have written job references for people. So, so do keep that in mind. You know, we love to see our folks, you know, take the next step and then leave us. They leave us and we don't hear from them because they're doing well. And, you know, that's not a bad thing. So that's okay. That's great. Although we do love it when you drop back into our groups, because the people that are having a hard time, it's so nice for them to see somebody being successful. I am going to go ahead and give a close to our evening. Would you please join me in thanking our guests tonight? Very much appreciate Mark Liverman, Paul Hines, and Rosie Thompson. Thank you so much for sharing with us tonight.
And taking the time out of your evening. We do appreciate that also. I know that could be difficult.
Yeah, and so we have other, if you want to join our email list, we'll have other educational opportunities we're working on right now. One of them is ADHD, and just learning about that and how that affects people, because people don't always realize the impact that can have on someone. We do have a Bridges class coming up. Bridges is, I don't remember the whole acronym, but it is building recovery. And it's for those of you with lived experience to understand your experience and move forward. If you are a family member of someone with lived experience, we are having the Bridges class is online, and it also covers those in Robertson and Dixon County, but anyone is welcome. But we have our group leaders are from those counties too. We have a family caregivers class coming up in March. It is in person. And that will be, that's an 8-session intensive class just for caregivers. So check out our calendar on our website. That's where you'll see our events and what we offer. And if we can help you in any way, we'd be glad to. And thank you. Thank you all for coming, and thank you, speaker.